Hello, everyone, and welcome to this audio podcast. As part of the Spectro integer. This audio podcast series is part of the Chromulin series. This audio podcast is part of a Storm Robotics production. Today's audio podcast looking at Haematuria and Public Health and Epidemiology. Haematuria, Public Health and Epidemiology as part of work published works from 2015 and part of published works where the published works had been a clinical correlation publication. So hematuria is relatively a sort of a generic finding, if you like, a generic finding amongst laboratories, and has many potential underlying causes, however, ranging from physiological to life-threatening. The prevalence of hematuria on urinary investigations have been published across several population cohorts, such as patients attending hospital appointments, attending such as such as patients attending hospital outpatient appointments in occupational health programs and in large medical insurance insurance health screening programs, and has been found to range from anything from in around 2% to 16%. Retrospective investigations of hematuria using urinary microscopy has shows a pre- has shown a prevalence or shows a prevalence of in around 1 to 5%. However, the range also varies depending on the definition of significant hematuria. That draws this audio podcast to a close. This audio podcast, as part of the Chromulin series, as part of this audio podcast, as part of a Spectro integer, and this audio podcast as part of a Storm Robotics production.